We white balanced.
I have your other white. Do you need your other whites?
Oh, no, we're good.
Okay, so what we're going to do right here is we're just going to, I'm going to hit record here. We're going to try a few just normal questions. So I'm going to have you just, what's your name?
Joel?
Okay, and just kind of talk through just anything that, what do you think of the last speech that you just did?
I thought that last lecture went smashingly. And I was definitely the best-looking lecturer, first and foremost. And my answers certainly were not clouded by anything but pure knowledge of the topic.
And may I ask you a question really quick? I have two, basically, would we like just a straight-on shot like this? Or would we like kind of off-center, kind of got scenery behind them?
I would do on our hand because especially if it's going to be embedded in it. It's coming on somebody's email and it's just a little smaller clip. I'd rather see his face.
Absolutely.
Makes sense.
Not a problem.
Okay.
All right. Sorry. Yep. Thank you, sir. Okay. And we're good to go. So if you guys just ask questions.
Okay. So I told him I'm going to give him the topic and then he's just going to start talking. So it's not like I'm a moderator or anything like that. Okay. So the first one is about why compounding versus traditional medicine. Basically, what's the benefit of compounds to both the patient and the practitioner?
Gotcha. Compounded pharmacy is beneficial to patients and to prescribers in multiple different ways. We are able to place several medications into one topical cream or a lotion or ointment to relieve pain. Oh, darn. Can we start over? Darn. Good. There are several reasons for physicians to prescribe topical compounded medications. The first one would certainly be the ability to place several medications into one easy-to-apply base form, which would be an ointment, a cream, or a gel. This helps the physician in as much as the patient is not taking quite so many oral medications, which could then give him side effects, whether it be nausea, fatigue, sleepiness, drowsiness, what have you. The other great benefit would be when a physician is treating a patient with other comorbid conditions, whether it be something like diabetes, whether it be renal disease, even with heart disease. We know that there are certain medications that are commonly used for the treatment of pain, whether it be an anti-inflammatory, a muscle relaxer, that in these cases, certainly patients with diabetes, we must be careful with those medications. Patients with renal disease, the use of anti-inflammatories certainly can be contraindicated. And patients with potential cardiac disease, we know there is a link with heart attacks and anti-inflammatories. Finally, many of the medications used to treat pain take quite some time to get an adequate dosing or a good drug level with, which makes it very difficult many times for the patient to take the medication. So when we can put 3 or 4 medications into a compounded cream that the patient applies 3 or 4 times a day, we get better compliance than we do with a patient who may have three pills a day of one pain medication, 2 pills of another, and suddenly they're taking 7, 10 pills a day. And truly, we know from studies that patients who have 7 or 10 pills to take a day, they never get their full course of treatment in. So it's actually a benefit to treatment as far as that goes. The end.
Okay.
That's very good.
Okay.
Very good.
And again, we can even pull just little sentence fragments. Do you know what I mean?
Perfect.
You've got a good tempo going, and your
Gotcha.
voice level is absolutely perfect.
So don't worry if you mess up, just keep going because they can add
Just
whatever.
cut it out.
Yeah, so just keep.
Can we do one more?
Oh, yeah, we got plenty more.
Okay. Okay.
Okay, and then this is the one we were talking about,
Why use Summit Pharmacy? Why would you use Summit Pharmacy for your compounding needs? There's several reasons for this as well. First of all is the ingredients that Summit Pharmacy uses. We purchase our ingredients from 2 of the highest quality and best regulated manufacturers in the market. So what we get for the patient is high quality. The second part to that is one of our providers also does significant amount of studies on their bases, so we know that these medications are going to penetrate and be delivered to the receptor sites necessary to treat pain adequately. The second part to this would be the fact that the way that the compound is manufactured, or not manufactured, the way that the compound is made in our pharmacy. We use the best ingredients, as noted before, but we also use the best equipment to make this compound. So whether it be the scales that we use, the hoods that they're measured and weighed out under, the base cream that we put it in, and then the mills that we use to grind these compounds up. We know that the compound needs to be ground to a certain degree so that it can actually penetrate, so the medication can get to the spot that it needs to be done, and these mills certainly do that. The other part to this is the fact that the mills and the mixers that we use create a very consistent, creamy, easy to apply compound. We certainly know from our testing and talking with patients that they like the consistency they get, and if patients like it, they're going to use it a little bit more as well. We consistently test every compound that comes out. It gets checked for grittiness as well as for stickiness prior to it actually gets sent to any patient. So the making of these medications, there's a great deal of attention to detail as well. Finally, and equally important, is we want to make sure we're delivering a compound that has in it what it's supposed to have in it. So we utilize an outside lab and send all of our compounds to this lab to make sure that when we make a compound, the percent of ingredients that are supposed to be in this compound are actually there. And we are consistently within 2% as we test our compounded creams. Finally, one more finally, our compounding technicians are actually tested and held to a standard so that we know that the compound that they make has been checked by an outside lab, and that what they're making actually is what the doctor is prescribing. And after all, that's what we want to get. We want to get the medication to the patient that the physician feels is indicated for the treatment of this patient's painful condition. The end.
You want to maybe, in some of the different areas, like a foot and ankle or one of your tendinitises or something, can you pull out maybe one of the most popular compounds and why? Like, you know how you talk about, oh, it's got a muscle relaxer and it's got a anti-inflammatory and a heating or whatever. Are there any
Sure.
specific, kind of talk about maybe
Some of the ingredients and
trying to
stuff.
talk a physician into,
Sure.
Out in the field, a lot of the doctors are liking the diclofenac more than the ketoprofen. So
Mhm.
we do the diclofenac 3 or 5%, cyclo 2, baclo 2, gab 6, and like a lidocaine or a tetracaine or bupivacaine, whichever one you want to use.
Gotcha. So there's a couple different, we could talk to the orthopedist as well as some of the pain guys and things of that nature.
Give an example so anybody could pull this off and say, I need to talk to my ortho about this.
Gotcha.
Here's the next
Okay.
clip.
Gotcha. Are we ready? Cool. Okay. So in the arena of compounding, there's certainly many physicians will utilize what we're able to provide their patients. For instance, an orthopedist who is treating a patient with a painful joint. Orthopedists very commonly use topical medications for the treatment of arthritis and post-surgical pain, things of this nature. We have several compounds that achieve this goal and achieve it wonderfully. For instance, we have an anti-inflammatory compound that is put together with menthol and capsaicin that is wonderful for treating arthritis in the knee, shoulder, ankles, things of that nature. These are well-known and well-used medications, and diclofenac would be the anti-inflammatory that we like to use. We know that there are products out there that are available commercially with diclofenac in it. However, the benefit, and one of the benefits of utilizing compounded medications, is the fact that we can personalize this dose for the patient so that instead of receiving 2% or 1% or 3%, we can do multiple different percentages, whether it be 2, 4, 8, 10%, to deliver more of the anti-inflammatory as based on what the prescriber is looking for. So the orthopedists are very pleased with these kind of medications. Those treating perhaps even some stronger pain find it very beneficial to utilize multiple combinations of medications. So diclofenac, the anti-inflammatory, is commonly used, and it's used for its anti-inflammatory properties. Oftentimes we'll throw the physician will request something like Neurontin or gabapentin. That's very useful in neurologic or neurogenic type pain or radicular pain. They also like to throw in Flexeril, which commonly taken orally is a muscle relaxer, but when placed topically, actually works differently and targets another pain receptor to relieve pain. They'll also commonly utilize a medication like ketamine, which is a wonderful pain reliever for many of these patients in this whole compounded cream. And finally, lidocaine or bupivacaine or tetracaine is commonly used for its properties and how it affects the pain channels up and down the spinal cord. So this combination of being able to receive 4 or 5 different medications to effectively treat pain is very valuable to the pain physician. As we talked about before, it's incredibly valuable because if the patient was to be treating themselves with 4 or 5 medications, it would necessitate multiple pills throughout the day, many of which would not be getting to the patient because we know that compliance after you take a pill more than twice a day drops significantly. And this way we can get all those medications to the painful area in one compounded cream that's used 4 or 5 times a day perhaps, and sometimes even less. How is that?
Some people have asked, and you briefly touched on the whole suppliers thing, but if you can maybe even just do one little snippet. Somebody was saying, do you get the ingredients made in the U.S.? You know, are you getting stuff from China or whatever?
Okay.
Can you just do maybe just a quick little, you know, where we...
Yeah, they're FDA approved and they supply a certificate of authenticity for all
Gotcha.
their products.
Okay. So,
Do a 14-point check,
Actually,
sorry.
can we hold 1 second?
Sure.
Yep.
And they do what, a 14-point check? So if somebody specifically said, what kind of ingredients do you use?
gotcha. Again, why would you use Summit Pharmacy for your compounding needs? We certainly know that our ingredients are top-notch and the best in the country. The ingredients we receive from our suppliers are FDA approved. They go through a... Damn. Okay, so why would you use the ingredients for your compounds from Summit Pharmacy? Our ingredients come from suppliers that are in the United States. They're FDA approved. They do have a certificate of authenticity. Gosh darn it all.
She needs her cue card.
I know, I need a cue card. Certificate of authenticity, how many points inspection? 14-point assessment inspection? Okay. So why would you use Summit Pharmacy for your compounding needs? Once again, let's touch on the ingredients that Summit utilizes. We know they're the best studied out there, and the bases that the ingredients are placed in are top-notch. The ingredients themselves that are being put into our topical compounds are made in America and come from American companies. The second part to this is there's a certificate of authenticity that comes along with each one of these, and each one has a 14-point inspection? Okay. Each one has a 14-point inspection to make sure that the ingredients that we're receiving are what they should be, we're getting the appropriate amount, and so that as we make a compound, you can be assured that the prescription you write for is what you want to deliver to your patient. And that's what we'll provide you from Summit Pharmacy. Boy, that was a tough one.
Sorry, you don't have a tongue twister. And then, no, since we have April here, I don't know if you want to do anything, but do you, somehow, somebody was asking, I think it was the Mango guys were asking about how they like our team approach of how we, you know, we've got you're kind of asking questions, you know, you're actually practicing physician in the field. So how, basically, explain kind of how our team approach of working with the physician to customize the compounds and have all this resources available.
Okay.